Welcome to your Invisalign journey with 425 Dental. We are so excited to have you here with us as we work together to achieve your dream smile. Let's get started. Aligners must be worn 22 to 23 hours daily. It is imperative that you follow the guidelines that Dr. Olick has specifically planned for your treatment in order to see the best results from Invisalign. If the aligners are not worn properly, your teeth will start to shift back into their original positions and will not be on track with the projected outcome. Our staff will instruct you when to change into your next aligner by labeling the bags with the dates they need to be changed. It is important you follow these dates exactly, as well as the instructions provided by our orthodontic assistants. Failing to do so may result in a delay in achieving your desired outcome. We strongly encourage you to wear your aligners during meal times. Leaving them in while eating provides additional wear time and helps keep constant force on your teeth without the back and forth motion of removal and replacement. Immediately after eating, please take time to brush your teeth and clean your aligners so food particles, bacteria, and sugars are not trapped on your teeth for extended periods of time. If your time is limited, take your aligners out, rinse your mouth with water, and put them back in. If you're having difficulty eating in your aligners, you can remove them, though make sure that they are only out a maximum of 30 minutes at a time. Be aware that some foods, such as curry, turmeric, and red sauce, can result in staining. Stains will not compromise the integrity of the plastic, but may not be visually appealing to you. We suggest you brush your teeth and aligners after each meal. Without regular dental hygiene, your aligners will trap sugar, acid, and bacteria directly against your tooth structure, causing acceleration of the decay process and resulting in cavities. For general aligner cleaning after meals, you can use your toothbrush and toothpaste or even dish soap. There are 3 sample packs of cleaning crystals provided in your Invisalign box. When you run out of these, you can definitely purchase Clean Night on Amazon.com or buy any brand of denture cleaner from a drugstore. These products help pull stain and bacteria for a more deeper clean. For a more natural approach, you can use a 1:10 ratio of white vinegar and water dilution. Please do not use anything that is not safe to put into your mouth to clean aligners, such as bleach, Windex, or any household cleaning products. Do not put them in the dishwasher or use boiling water, as they will distort the aligner and they will not fit anymore. Each aligner in your treatment has incremental movement programmed, and it is up to you to make sure your teeth are tracking. When putting your aligners on, they are 95% seated on your teeth. You will need to use your chewy we provide to help push the aligner the remaining 5% of the way. You will bite and squeeze the chewy between your teeth, going from the right to the left all the way around. Please make sure to do this anytime you remove or replace your aligners. The munchie we provide is used at night before bed. After you have eaten dinner and brushed your teeth, it takes 5 minutes to use the munchie, concentrating on the top and bottom front 6 teeth. There are 3 sides to the munchie, and each side is used for specific teeth. Use the round depression side on the tips of your canines and squeeze for 30 seconds on each side. Use the large slot on the upper front 4 teeth and bite and squeeze for 30 seconds on each tooth. Use the small slot on the 4 lower front teeth and bite and squeeze for 30 seconds on each tooth. If your jaw gets sore or you are breaking the munchie, you're biting too hard. The munchie helps seat the aligners even better on your teeth, thus helping the plastic grab on the teeth and or the attachments and aid in movement. Please note that the munchie we provide should last the duration of treatment. If you lose or break it, there is a $5 charge for a new one. If you begin to feel sore, don't worry. This is a normal occurrence with Invisalign. It is expected that you will feel sore for the first few days of every new aligner, but it should subside towards the end of use. If you are in need of a pain reliever at any point throughout treatment, we recommend Tylenol if there are no medical reasons for you to avoid it. If you take ibuprofen or any other anti-inflammatory, this will decrease the inflammation and your teeth will not move as efficiently. When it comes to moving your teeth, inflammation is a good thing, as it increases blood flow and helps aid in the movement process. This does not mean that you cannot take ibuprofen for other injuries or pain, but for any pain in the mouth, please stick to Tylenol if possible. We have provided you with a small nail file to smooth out any rough edges on your aligners that were left behind from the manufacturing process. If any sores develop on your tongue or cheeks from the aligners, please use a warm saltwater rinse 2 to 3 times daily to help heal and toughen up these areas in your mouth. It is common for your speech to change when you first start wearing your aligners. This is normal and will subside with a couple days of use, or even a couple hours. Talking out loud more frequently will help assist in this process. Taking them out during meetings or conversations will only make it harder to get compliant in wearing them and will delay your treatment. It is also normal during treatment for your bite to not feel quite like it used to. As your teeth move, so does your bite as it's in relation to your joint and muscles. This is nothing to worry about and happens to everyone. We will monitor your bite throughout treatment and make sure it is in a comfortable and healthy position when you are finished. At your first visit, we will place attachments on your teeth. These clear composite bumps are programmed with different shapes to help guide your teeth into position. Attachments can sometimes fall off, especially if you have any crowns or fillings. If you notice an attachment is broken or missing, it is not an emergency. There is no need to make any additional appointments, but you do need to call or email to inform us. We cannot use your aligner to repair your attachment, so we will need a heads up in order to prepare to repair at your next scheduled visit. Do not put your aligners in your pocket without a case, as they will break. The rule is if it's not in your face, it's in your case. Keep them away from your pets. Your dog will definitely turn them into a chew toy, even if it is in the case. The most common way to lose an aligner is to wrap it in a napkin and accidentally throw it away. If you've moved on to your next aligner, do not throw the previous set away. In the event that you lose or break an aligner, you may need to step back into a previous set. However, if you lose an aligner more than halfway through your instructed wear time, you may proceed forward to the next aligner. Wear the new one until the date on its bag and proceed as scheduled. If you are less than halfway through and you lose or break the aligner, you will need to go back to the previous one. Call our office for a replacement. The replacement charge is $75 per aligner. It can take up to 14 business days for us to receive them. Please come to your next in-office visit wearing your most current aligner. If you have any questions, don't hesitate to ask your orthodontic assistant. They are more than happy to help.